Hello there. You are watching COVID Fellows, a video interview series with the administrative fellows working through the pandemic. Hi, everyone. I am Audrey Workman, and I'm here today with one of my peers, Rachel Kuhnly. Rachel is an administrative fellow at Allina Health here in Minneapolis, one of my neighbors here. I'm excited that you've been able to join us this morning, Rachel. Thank you for being willing to do this interview.
Yeah, thank you, Audrey. This is such a great idea. I was able to watch Travis's last week, and this is just such an awesome idea to hear from people across the country and how we're responding and how we're involved in the COVID-19 pandemic.
Yeah, I was really curious to hear how everyone was impacted. It totally shaped my fellowship, and I was eager to hear all the other cool things that other fellows are working on and ways that they're helping our community. So I appreciate you spending some time here with me this morning. I would like to start off by just asking if you could tell us a little bit more about your fellowship, just for some context as we get going.
Yeah, so like Audrey said, I'm working at Allina Health, which is in Minneapolis. It's a year-long fellowship. It's not rotational, so you kind of make it what you want it to be. So I came in with some goals, and then you talk with your preceptor based on what fellowship you're in and understand where the strategy is, where they want you to be aligned. You're aligned with the strategy of the organization and figure out what would be best for you to be involved in. What are your goals? Let's make sure that you accomplish them. And then you kind of structure your fellowship based off of that. So I was involved in a lot of strategic initiatives before COVID happened, just because I wanted to understand where Allina is going for the future and then be a part of that, hopefully.
Great. So was it really self-driven then? Like you were able to pick out those goals and really shape what your fellowship looked like?
Yeah, which was really cool because you got to be involved in things you're passionate about, or also be involved in things you had no background experience in or involvement in, so you got to learn that way. And then you just talked through that with your preceptor and made sure that you kind of had the final stamp of approval and or better suggestions that they knew you should be involved in other areas, or this is kind of the section you should be involved in, that big strategy. So really guidance from them and understanding of where this could lead you to stay within the organization and be aligned with the strategy going forward. So it was kind of a cool setup, I thought, and that's what I was interested in, just because I didn't really necessarily want the rotational fellowship because I did my residency at Allina, and I felt like I had a good understanding of the operations and was able to do some shadowing during that and felt like this would be a better fit for me going forward.
Mm-hmm. So what are a couple of areas that you are passionate about that you are excited to learn more about in your fellowship?
I was really excited about ambulatory space because in my residency I was at Abbott Northwestern, so it was all hospital based and did all hospital projects and shadowing. So I was really excited about the ambulatory space. So I did a lot of involvement in the clinics and shadowing in the clinics, and did a lot in the ambulatory surgery strategy, and really involving myself in the Allina Health group, which is most of our outpatient work. So I thought that was very exciting and a great opportunity during the fellowship.
What are some things that you are working on now to help Allina Health respond to COVID-19?
Yeah, so probably a couple months ago, the time goes so fast, I was called to go into the Incident Command Center for Allina Health, and I was given the role of planning section chief within the HIC structure, so really planning for the operational period with the leaders, doing the dissemination of information, making sure aligned communications, so a lot of duties within that role. And so I learned very quickly, and we were just setting up the HIC structure, so there was a lot to work on. So I did a lot of process improvement within the HIC structure as well, and understanding, okay, what is our day-to-day now? Are we fully involved in the HIC structure as we moved forward with the COVID activity, because we didn't know how big this would be. There's so much uncertainty around that, so really understanding what is our strategy going forward with this. And then once it progressed in probably April time, we started doing the surge planning, which was our main focus. So now I'm kind of the the liaison between the surge plan and incident command. So I fully sit in the incident command, but involved in a lot of activities in surge planning and being that point person between the two to make sure that those two big groups are aligned during our COVID activity.
So is that hospital surge planning or beyond that as well?
Hospital and clinics, so outpatient and inpatient. Outpatient just primarily on testing, and then inpatient on treatment.
Gotcha.
Mm-hmm.
Yeah, that's a lot different than some of the strategic work that you were working on before.
Yeah, it was quite the pivot. It was interesting to use your strategy brain and then pivot one day to full operational sense. So it's been a really good experience being able to do that.
Yeah, it's like you're exercising different muscles.
It is, it truly is, but it's good to have both and experience in both. So I'm very grateful for that.
Mm-hmm. Is there anything else that you're working on to respond to COVID-19?
I would say I'm involved. So with my role, I'm highly involved in doing a lot of the surge planning. So understanding, okay, how many beds do we need? Understanding a lot in the med and infection planning. So a lot in the continuum of care. So understanding how can we better partner with our senior care partnerships? How can we better create a more robust home health program so that we keep capacity out of the hospitals when appropriate, to ease the burden on them and really provide for those really sick patients. And so I would say there's a lot of more strategic planning in that sense, that we're planning for the future and having to pivot to different ways of treatment that we've never done before. And I think that's pretty cool in that sense because we've never done that before and we've never had to respond so quickly. So I think the nimbleness in that has really made me excited to do some of that work.
Mm-hmm. Have you seen your interests shift at all as you've been exposed to more of the operational aspects of emergency response?
Yeah, that's funny you asked that because I was very much in my strategic work, I was very much interested in strategy going forward. But I think this also opened doors to operational positions to maybe sometime in my future because I do really enjoy it. So it's hard to tell which one I enjoy more because I think they're both equally enjoyable. It's just kind of where opportunities are. And right now it's just been really fun being able to experience both.
Mm-hmm. So what are some key learnings that you've taken away from your whole experience and in the incident command center?
Communication is key. I know everyone always says that, but having just really crisp, clear, aligned communication is so important, especially in a pandemic, because so many people have so much fear and anxiety, which is totally understandable and inevitable. But just by providing that communication and making sure everyone's on the same page, it alleviates some of that, not all of it, but it definitely aids in the process. And if, on the other hand, if it's not aligned and if people are confused, it really makes something as urgent as this is even more complicated to handle and deal with as an organization. So I know we've really learned you have to have that clear communication, make sure everyone feels informed, make sure you're saying it 7 times, 7 ways. That's what we always say, to make sure everyone feels communicated to during this process.
Mm-hmm. Have you seen improvements in communication as time has gone on, as well as an incident command center has evolved a little bit?
Definitely. Before, we were just sending out communications when needed as FYIs or action required, but now we have set communications to leaders at a certain time. We have set communications to all employees. We approve the information before it goes out, so we make sure that it's clear. We have a touch point every day to make sure that everyone's aligned on when is it going to be communicated out, what's going to be communicated out, is it clear enough that everyone's going to be able to understand it and be able to take action on it. So we've been able to really create a structure around that to make sure that people feel communicated to, and that was in response to not doing that in the beginning, and also having this time between now and the surge to be able to plan for that. So we have that structure going forward when the surge does come.
Yeah, that's great. It really is critical. And I saw as well in
Mm-hmm.
my organization that we we ramped it up a little bit and got into a good routine with our communications.
Mm-hmm.
Yeah, it took us some time to get there,
Yeah,
definitely.
I think it does for everyone, but once you do have the structure, it's so much better.
Hmm.
People know what to expect.
Yeah. In a time of high anxiety in our communities across, well, really across the world,
Mm-hmm.
um, that that type of clear communication really is critical.
I would say so, yeah.
So, are there things that you've learned that you just know are going to impact you throughout your career?
I think something that will impact me throughout my career is to show how nimble an organization can be when barriers come down and you really have one true strategy going forward. So before this, we did have a strategy and we were moving towards it, but we quickly had to pivot into a full-blown COVID strategy. And because of that, everyone was on board. A lot of barriers were broken down that were typical in any health system, and we were able to completely focus, and everyone's attention was on COVID, and we were able to stand up so many things in amazing amounts of time that we could have never imagined before. And I think that's something that everyone will take away from this experience on how can we bring that kind of movement forward into our day-to-day working lives after COVID, because you can move so much in healthcare and make it so much better in a short amount of time if we're able to have those barriers brought down and be able to really focus on one true strategy. So I think that's something a lot of organizations will learn from this. And I know I did myself, and hopefully as a leader one day we'll be able to utilize.
Yeah, I mean, I think that's one major benefit, if I can say that, of uh, going through this pandemic together. I think we've been able to accelerate a lot of changes that have needed to happen for a long time.
Mhm.
I hope that the pace of change in a lot of ways continues moving forward.
I
Um,
hope so. It's exciting, isn't it?
it is exciting. And as fellows right now, I mean, we're the leaders of healthcare organizations in the future, and we're being shaped by these experiences. And I hope that we can remember how quickly things changed and how some of those barriers you mentioned were removed so that we could actually adapt
Mhm.
in the ways that we needed.
Yeah, I'm confident with how every health organization has pivoted that this will only help the safety, quality, and patient experience for patients going forward from this.
Yeah, great. Well, Rachel, is there anything else you would add for our viewers? That's all the questions I have for us.
I guess just thanks to everyone out there. I know everyone who's watching this is probably involved in healthcare somehow and is impacting so many people. So just want to give everyone a thank you for that, because we're all heroes in some way, shape, or form, helping communities and patients out there. So thank you, everyone. And this has been so enjoyable. Thank you, Audrey.
Yeah, thank you, Rachel. I really appreciate just being able to connect with you again and to talk to you
Yeah.
about your experience. I think it's really important to reflect on these things, and I think it's really important as well for our viewers to understand all the work that goes into responding to this pandemic. So
Yeah.
thank you.
Thank you, Audrey. This is so wonderful.
Thank you for watching COVID Fellows, an Admin Fellow video interview series. Follow Audrey L. Workman on Twitter or LinkedIn for more related content.